All right, so good evening, everyone. I know we are very small this evening, but I would like to think that we will be very mighty in our actions. So here is our agenda for this evening. And if you wouldn't mind, please put your information into the chat. Introduce yourself, your name, your pronouns, what town you're from. And the question for the icebreaker tonight is, what are your hopes for 2023? And my hopes for 2023, I'm not going to put it in the chat right now, is that we gain some momentum in the healthcare field and more people are covered. That is my prayer, and that is my hope, and that is my dream. And we all together are going to make these dreams a reality.
Good.
So, Rana, would you like to tell me what your hope for 2023
Oh,
is?
sure. So I'm Rana, I'm from New London, and my hope for 2023 in a very personal way is to catch up on everything that's kind of fallen by the wayside this past year during all the craziness. So I don't know, I'm hoping for that. Whole lot more. I want to see the study bill, for example, but I hope it's a year to actually feel a little caught up. And yeah, we'll go to Maggie.
Hi, my hope, I'm just looking on the bright side. I want to stay out of the darkness and just keep moving to the light, legislatively and social justice wise.
Okay. And Maggie, do you want to pick someone to go next?
Sheldon, hi, how are you?
Okay. What are my hopes? Well, I'll get really practical and parochial. I hope that Rose and I will both be successful in expanding the, I'll use the broader term, HUSKY program to cover more immigrants, and also for the Medicaid part of the program, which is the part reimbursed by the feds, that we expand eligibility for older adults and people with disabilities, so we end this atrocious discrimination in our Medicaid program against older people and people with disabilities, which I'll explain more when I talk.
So we have Pete and Rose left for them to give us what their hopes are for 2023. Pete, go ahead, and then Rose.
Sure. I'm Pete, he, him in Hamden. I guess for 2023, in addition to what everyone else already said, I'd like to see another municipal resolution effort get off the ground. If that would be, I think that would be really good to keep that momentum going. And also, if I turn my camera off, it's just because I have dinner here, so I don't want to see what's. But anyway, go ahead, Rose.
Hi, Rose Ferraro, she, her, Asia, North Branford, and Husky for Immigrants tonight. I put it in the chat, but my hope for 2023 is health justice. Some movement towards it. I echo Sheldon. I'd really love to see Husky C expanded. Yeah, I will pass it to, I think there's Denise.
Oh, I'm sorry. Yes, Denise, certainly not least. Denise, you are a sweetheart, and I'm sorry I almost forgot you.
Trying to unmute there. Okay. Good evening, everyone. Denise Hart. My hope for 2023 that we are all healthy. We all connect both mentally and physically,
Oh,
and all of our loved ones are in good health because boy, we lost too many people. We need to get back to hopefully some kind of what we used to be, if that's possible, or hopefully something better. Yeah, we can hope.
thank you, Denise. Thank
Yeah.
you, everybody, for sharing.
Yeah, keep the
Okay,
faith.
so tonight, Rose is going to tell us about the Husky for Immigrants camp. I'm sure you guys know who Rose is, but if not, she wears another hat with Universal Health Care Foundation, Universal Health Foundation. I get it confused. You know me, my brain doesn't work well all the time. Rose, I know her as just Rose, my high school friend, wife now, and Husky for Immigrants Coalition member, and Universal Health, and just an amazing human being who is fantastic. So Rose, if you would like to go ahead, please take it away.
Sure, no problem. Let me make sure I even have slides. I made these slides
So
some time
good.
ago. When we got some research done, I thought folks might be interested in some of the research highlights that we've got. We'll be sort of rolling out in the next couple of weeks, starting with tomorrow. So let me just share my screen. I'm not gonna lie. I'm not sure if this will work. Is that working?
Yes.
Yeah,
Great.
Awesome. I'm just gonna turn off my camera because it's very distracting for me to have me on the screen. So first and foremost, as Holly may have mentioned, the Husky for Immigrants campaign is doing a launch tomorrow at the LOB starting at 10 a.m. Lobbying will actually only go till about 12:30. And that's because there's going to be, they're stopping activities at the Capitol because they're doing a procession of Representative Williams's, they're doing a processional through the Capitol grounds. So we will be ending early for that purpose. And essentially, I'm so sorry. I forgot that like my phone is turned on. It usually isn't. So first and foremost, tomorrow is really our first sort of jump out in front of the 2023 legislature. There's some new legislators out there. We just want folks to know that we're here and we're going to keep fighting until everyone has coverage. So it's going to be our first sort of like I would say our first really big action of the year. We anticipate having more, so if folks can't make this one, that's fine. There will be other opportunities. But a Husky for Immigrants event is something to be seen. So one thing I wanted to talk about was one of the things that we're going to be highlighting at the launch as well as at the legislative briefing next week is some research we had done around the cost and impact of expanding coverage, as well as voters' opinions. So I'm just going to flip through those really quickly. Like, we don't need to do the you have somebody in the waiting room, by the way. You've got that? Okay, great.
yes, thank you.
So let's move on to Next slide. This is a picture actually from one of the actions last year. And this is just sort of a presentation I put together for the coalition several months ago around some of the research highlights. So I'm going to go into the cost and impact research really like super high level. I'm more than happy to share these slides with Holly, who can, if you want to send them around, that'd be great. There's actually links to the full report in the slides, so folks can dig deeper if they'd like. We had Rand Corporation through some funding. There's sort of like the long story of funding that nobody ever, trust me, that's the boring part. The interesting part was that the Rand Corporation has an interesting modeling software that's proprietary, it's theirs, but it can do some pretty amazing sort of economic modeling of changes in the health insurance market. So we had the RAND team study 3 policy scenarios, but really the first one is the one that matters, which is the one about expanding HUSKY programs. There are some research uncertainties. The nerd in me has to say that, you know, one of the challenges with modeling what health insurance coverage would look like for folks that are undocumented is that there's not a lot of great data about undocumented folks. So there were some if you look deeper into the report and you want to, you know, sort of get in the nitty gritty of the methodology, there is a range, right? Like, so these are estimates, it's not a perfect science. Highlights were that they found that 21,400, 21,700 in that ballpark, formerly uninsured people would be covered. And it would equate to 28,000 roughly new HUSKY enrollees, because some folks are actually paying for coverage when they could be covered through HUSKY. The question we get is how much would this cost to the state? And it's approximately 83.7 million for if this were done this year or next year, to cover all who are income eligible regardless of their immigration status under HUSKY. So this is full enrollment. It doesn't take into account that like the first few years, it's not going to be hit full enrollment. But this cost estimate represents approximately 3% of the state's annual Medicaid budget. So it's sort of it looks like a lot of money, but when you look more broadly at investments in health, it's actually relatively not that much money. There's also savings in uncompensated care for hospitals, about 63.3 million, which basically just means that instead of having to underwrite the cost of care, hospitals would be getting reimbursed through coverage. There also is possible savings that we would spend less money in emergency Medicaid, which does in fact cover undocumented folks' emergency needs, medical needs. And that's not a program they can enroll in. That is the way the hospital ends up billing the state. Other possible savings is this is really weedy, but there's a 1332 waiver. We could potentially recoup some federal dollars. So there, you know, this was something that the RAND report pointed out, but didn't go into great detail. So those are sort of like the super top line of the cost and impact report. This is, again, super top line of the opinion research that was done. And when I send the slides, there's the link to the full report and then a fact sheet we've created that's just 4 pages and a little bit more digestible. There was opinion and messaging research was done. It was 500 likely voters. We also had oversampling of Black voters and Latinx voters so that we could actually break out demographics that way as well. It was done last February, so there's been some time between this and that, but what you'll see is that people are actually pretty set in their ways when it comes to their opinion on this. This is the sort of a profile of who was sampled, and it's sort of mirrors likely voters in Connecticut. This slide is always interesting to people because I think folks don't realize that sort of the distribution of the counties and how many independents we really have. And so this is always a fun slide. So opinion results are that essentially a clear majority of voters support allowing everyone to have Husky health coverage regardless of their immigration status, if they're income eligible. And that support goes up when it comes to just kids. Connecticut voter support for Husky for all immigrants. So this is for everyone, regardless of immigration status. You can see sort of the way the support breaks down, but the folks that did this poll are pretty knowledgeable, and they were sort of like, yeah, this is really strong support. And the way this support breaks down demographically is based on race, ethnicity, gender, age, and party. So you can kind of get a sense of what supporters would look like, right? Like, so 84% of Democrats, for example, would support this. We see less of that support in the Republican, and it sort of kind of starts to get split, right, with independents. We see that younger voters are more inclined towards this, so you can see where I think this could be useful with legislators to really get an idea of essentially what their constituents would like. And so we hope that we'll continue to be able to share this particular information, not just with the public, but with legislators, so that they understand that this is something that's popular, that the electorate is a little bit ahead of them right now. This is where we see, even stronger support for Husky for all immigrant children. And again, it breaks down pretty similarly. There's just a lot of support. And before I go back to the campaign launch, one thing I wanted to let folks know is part of the reason why we asked separately about all people and then all children is because Connecticut so far has expanded from ages 0 to 12, as well as pregnant people. They've expanded regardless of immigration status. Prenatal and postpartum care coverage begins this April.
Good.
So it is true that children in the program, when they turn 13, if their family is still income eligible and remains income eligible, they can stay on the program until they turn 19. But right now there are children 13 and through 18 that would be essentially blocked from having coverage. And obviously parents, grandparents, you know, like whole families, right? So it's very limited right now, and which is why I reiterate, we're launching our campaign again. And we're hoping to have a lot of folks there. We anticipate groups, you know, one of the great things about the coalition is its great diversity. And it's immigrant led as well. So there are a number of powerful stories that get told at every event. Not the same stories, unfortunately. There's, I don't know if folks ever had the opportunity last year or heard about, but our public hearing was 12 hours long. It was, it's hard to find a positive word for it, because the stories were powerful, but also heartbreaking. And we know that a lot of those folks are still struggling with their health because the expansion just did not go far enough. So we're in it to win it. The coalition has been in existence since about 2019, has done most of its work actually during the pandemic, and is a really committed, passionate, dedicated group of people. So, and we're lucky to have Holly represent y'all there. And I'm glad I was able to talk a little bit about the campaign tonight. So if folks have questions, I'm totally open. I will stop sharing now. Show my face. Denise, yes.
Hi, with all the covering of the immigrants coming in, we do want everyone to have coverage, and we want to make sure they're healthy before they interact with us. Is it going to affect those that already live here, getting the support from the Medicare, Medicaid?
Yes, so this is for folks that are Connecticut residents.
Oh, Connecticut residents. Okay, I thought you were talking about people coming into our country. Okay.
Well, I'm assuming that if folks are coming into our country and end up in Connecticut, that they'd be Connecticut residents and eligible if the policy actually ends up passing. You're right. It's only the children and pregnant people right now that have coverage.
Why do they make differentiation between when the children are 13? That's when they need it more, because they're going through puberty changes, and you know.
We have it's the very first year we got an expansion, they did it up to age 8, and then we pushed for 12. So it's really quite frustrating, especially when you see the voter support. We often hear from legislators, well, you know, it's a little controversial, but when you look at the voter support, we feel like a lot of these arguments fall short. There's a lot of talk about how much this would cost, but you know, we have seen estimates from the Office of Fiscal Analysis at the legislature that were pretty wild. And so we set out universal help facilitate getting the study done, because we needed to be able to say with some confidence and with some clarity and with some independent research that what was coming, the estimates that were coming out of the state were just sort of wildly overblown. Which we're able to do now, right? Like, so every bit of research makes the campaign stronger.
Now, what about the children that are 13 to 18, say for instance, they're a diabetic, or they need seizure medication, or whatever the case may be?
What are they doing now is your question?
Yeah, what are they doing for those children between 13 and 18?
So right now they're doing nothing.
So in other words, they could have a heart attack or whatever and die, whatever the case may be. That's beautiful.
Once a condition becomes an emergency, then it's covered through emergency Medicaid.
Okay.
But it has to become a life and death situation, or labor and delivery is also covered through emergency Medicaid. But Sheldon went through the Husky for Immigrants work with Sheldon for was it last summer, Sheldon, around the dialysis coverage, because folks were essentially like trapped in the hospital because they couldn't get outpatient dialysis and they needed that to survive. So they'd get dialysis in the hospital and end up back in the hospital because they couldn't get outpatient. It was only being covered inpatient. So now dialysis outpatient care is covered through the emergency Medicaid program, thanks in part to a lot of Sheldon's work. And that was not a legislative win, that was a administrative advocacy. So that was really important. There was actually an undocumented patient who had been in the hospital, was it, Sheldon, like 9-10 months?
Oh, God.
It
Yeah.
was a very long time.
It was a
horrible.
very
Uh-huh.
It was, yeah, truly horrible.
The poor
It was
kid's missing
hell.
out on life.
Yeah.
Yeah, you're not being in school, you're not interacting, wow. That's
so
insane.
there's I mean, I think there's something about believing in this and on a theoretical, like as a value, but then when you hear stories, I think every year we're a little like, wow, people are just not hearing the actual, what's actually happening and what's going on in the community. So we continue to fight. The coalition's committed to a multi-year fight, and I think, we have a lot of values alignment between Medicare for All CT and Husky for Immigrants. So
does anyone else have any other questions? Because quite honestly, my comment is, I can't believe after the 12 hours of testimony that everyone gave, that they had the nerve to say no and to only give it to age 12, because that to me was the most heartbreaking of the 12 hours. Go ahead, Sheldon.
Oh, you're muted, Sheldon.
Sorry. Thanks for the presentation. Very much appreciated. I am good zoning onto the wonky thing. So basically, the proposal is not just for undocumented immigrants. It's, to be correct, I mean, this is a question. It's also for the people who are legally here. They have status here. But unfortunately, since before most of you were born in 1996, President Clinton, remember that wonderful guy, ending welfare as we know it. One of the things that was done at the same time we ended welfare as we know it is to impose a 5-year bar on legal people. Most, not, there are certain categories, but most legal people, a 5-year wait from the time they have the legal status until they can get the benefits. And then when Obama came in, and he won the Congress, the very first thing he did, 2009, was to create an option for the states to cover the most favored, which is pregnant, I'll say women, because that's what it was then, pregnant women and children. So the states were given the option, and most states did it to some degree. They've done sort of like some mix of that, but most states, including Connecticut, did those two things. Okay, that's great if you're a child or you're pregnant, and if you're not, so that's still out there. But my wonky question was, so the reference you said about some, doing the costing on the 1332 waiver. My understanding is that the people who are here less than 5 years can get subsidies on the exchange, and those are federal dollars. So that's what we're talking about. We could.
Right, exactly. Because by saying, so our intention is to, if folks are income eligible, regardless of immigration status, whether they're undocumented or under this 5-year bar and legally present. So the idea is for immigration status to no longer be the issue. So yes, that's where some of the savings for the 1332 waiver would come from. Maggie, I see your hand.
Yeah, now can you tell me, like right now in January of this year,
Mhm.
what age, who is actually able to apply? Are we up to 12 yet? But
Yes,
we're not up to, so 12-year-olds can apply.
yep.
And so when did that start? Like if you turned 13 in, you were 12 in December.
Right, if you turn,
Or
so you have to be, I believe, 12 as of January 1st of this year.
Okay.
12, okay.
Yeah, so like
And
if
then the-
somebody turned 13 December 31st, they're like, this is the
They're not-
irrational nature of the policy.
I know, it was criminal. The 8-year-old really made me wild 2 years ago. But, okay, and then the pregnancy is still, they're still not eligible until April.
So prenatal care folks are eligible as of April of last year, but for postpartum care, they won't be eligible until April 1st of this year.
Oh, thank goodness we saved that money. Isn't that wonderful?
That 1 year, yes.
Yes.
So yeah, there's certainly like, you know, there's the moral outrage, and then there's also just like the cost argument that really starts to fall flat. But I agree though that with what Sheldon said earlier around like ending discrimination based on immigration status and
Right.
age and disability, right? Like what we really need to see is this across the board. I was talking about the HUSKY C eligibility earlier today, Sheldon, and folks were like, wait, that doesn't make any sense. And I was like, yes, I know. It's a terrible thing. And there's
Right.
finally, you know, some movement to try to get, which I know you're going to talk about later. So I won't step on your lines there.
This is another, just a little wonky, just for me. What is the income eligibility for the folks that have been here for 5 years and the dreamers or whatever? I mean, is it, what percentage of poverty?
It would depend on whether they are a parent
Okay,
or have no dependent children. So
okay,
it would depend on, so that sorts them into either HUSKY A or HUSKY D, and those have 2 different eligibility levels.
Yeah, don't
And
be
then-
disabled and not have any children because you're really in big trouble. Trust me, I know.
right. But they would be under the legislation that we're asking for this year, is that those people, if they were disabled, would be applied to the HUSKY C guidelines?
Yeah, see, we're not clear on that. We, because the HUSKY C eligibility is so low, we did not have
Mhm.
Rand actually cost that out. So it would be, so folks would be able to have HUSKY D, but that may or may not have the services that they need if they have a disability.
I could actually also elaborate this part, which
Okay.
is that
Awesome. Thank you.
HUSKY D is available for all adults, mostly. But there's 2 assuming income and putting aside immigration. But there's 2 exclusions. One is if you're 65 or older, or you are on Medicare. These folks will never be on Medicare by definition, because they don't have the immigration status, and changing that in federal law is like, I'm sure that McCarthy and Boebert are totally on board with this. So as a practical matter, since they can't be on Medicare, they could be eligible for HUSKY D. So from that point of view, you could say that it's like tell me if I have this right, Rose. What the legislation says, and previously says, basically apply all the same rules, the income eligibility rules, everything, except that stop looking at this immigration status, right? So that's why
Yeah.
when you said about the A versus D, they have different income levels. That's right. And then
Right,
go
exactly.
by whatever that standard is. And if somebody does have children, then they would be eligible for the higher income guidelines of HUSKY A versus HUSKY D, because they have children. You just treat them just like anybody else. They just, regardless of immigration status. But the HUSKY C thing is more complicated, in part because it is people who can't be at, not 100%, but largely can't be on HUSKY D because they are eligible for Medicare or they're 65 or older, and that excludes them. Does that make sense? Okay.
Right.
That's helpful. I always forget the
Thank
ins
you.
and outs of HUSKY C, actually. So thank you so much, Sheldon, for helping answer that question.
Okay, guys, does anyone else have anything further since we've kind of gone into a little bit of HUSKY C? Does anyone else have any other questions? Or Rose, do you have anything else you would like to say?
No, just that if folks, can't make it tomorrow, we understand it's a little bit of a last minute request, but I hope that Holly will just keep passing along opportunities for action. And if folks have questions or what have you, Holly has my email, so you're more than happy to, excuse me, more than happy to answer questions or connect folks, or, if there's interest in, Medicare for All doing a visibility day at the Capitol, let's talk about it. You know what I mean? So, yeah, I'll let you guys get to the rest of your business. I am going to roll out because
Okay,
I have a very early morning getting to the LOB in time for all of this.
If I can, I will be there. And if I can't, just know it's because of this weather pattern. It's killing me.
Yeah, well, I gotcha. And I'm sure I will see some of you again.
You will.
And before you go, Rose, I wanted to tell you that we very much want you to be a part of the HUSKY C thing as well. And we were told, we sort of tentatively set up our meetings for Monday afternoons, and somebody said that you can't make it. And so we actually discussed, maybe we should change the time of our meetings so you can attend. I'm just telling you, that's where we're at. So
I had the pleasure of talking with Molly Cole about the HUSKY C issue, and it's, as much as HUSKY for Immigrants is aligned with Universal's values, expanding HUSKY C eligibility is also. So I certainly hope I can make the meetings in the future. So
Cool. Thank you,
So-
Rose.
all right, thank y'all. Have a good night.
Have a good night.
I just suggest that all of us, if we can't be up there, that we send a HUSKY C email to our legislators.
We will definitely be setting up things for to send out. Hopefully, if I can pull Pete back in once we get a little more organized, to do more Action Network things. So certainly we will be doing that, Maggie. And without further ado, I would like Sheldon to please elaborate a little bit further on the situation with expanding HUSKY C, if you would please.
okay, which version? The 30-second version?
The shorter version, we've already discussed a little bit, so please.
I can't do it in 30 seconds. So basically, there is a discrimination in eligibility as between the big three Medicaid programs. There's lots of Medicaid programs, but the big ones, the full benefit Medicaid programs, are HUSKY A, C, and D. HUSKY B, by the way, is a CHIP program for kids. It's not Medicaid. But the basics are HUSKY A is for kids, caretaker relatives of minor kids, and pregnant people. HUSKY D is the Medicaid expansion, the Obamacare Medicaid expansion, which now I think 41 states have. Like, we're getting there.
Yeah.
And that was really a major deal because it, for the first time, ended categorical eligibility. because up until that was passed, what we had is we call Husky A, families, kids, pregnant women, and Husky C, what we call Husky C, which is age, blind, disabled. So you have to be one of those groups. You got to be in a family with minor kids or pregnant, or you have to be 65 or older or meet the strict Social Security definition of disability. That's it. Husky, the Obamacare comes along and says, that's stupid. Why are we doing that? You know, we should just say low income, right? And so that's what they did. And they came up with a number. And they said 138% of poverty. This is the feds. States, at the time when they passed it, they said it'd be a mandate that all states are going to do the expansion. You know what happened? They were sued, and the Supreme Court split the difference and said, well, okay, you can go forward, but as an option. They set it at 138% of poverty, and they prohibited asset limits. They said that those don't really work, and they're very expensive to monitor and administer. It's just not worth it. So they said 138% of poverty for the expansion and no asset limits. Okay, that was great. They did that. One thing they didn't really focus on, though, was, well, what about the people who already have Medicaid now and like don't have very ungenerous benefits? So they didn't really do anything about the age, blind, disabled group. And they did a little tinkering with the Husky A group, the families and kids group, but they did nothing with the age, blind, disabled. So the result is that states around the country, not all, but tend to have very, very low income limits, below 138% of poverty, because that's what it always has been, very low, and low asset limits. So in Connecticut, 138% of poverty for Husky, the Medicaid expansion, Husky D. Roughly, it's not done as a percentage of poverty, but the effect is about 94% of poverty for age, blind, disabled, and 160% for parents of minor kids, and 201 for kids. So that the Husky, the question before, if Husky for immigrants works, will be all I just said will now apply to everybody regardless of immigration status. In addition, Husky C is the only program that has asset limits, and it's very low, $1,600 or $2,400 if you're married. So how would you save money for an emergency rainy day? Car repair, have to move, security deposit, just emergencies that come up in life. How would you manage that? Not to mention something as incredibly elaborate as maybe someday having a down payment for buying a modest house, right? So this is what folks on Husky C have to live with. And what I said before in response to Rose, there's overlap between Husky D and Husky C. You do have people who are disabled who are on Husky D, can be on Husky D at that higher income, 138 instead of 94. But if they're on Medicare, and that could be because they're disabled, not just because you're over 65, or you're 65 or over, either of those groups are categorically prohibited from being on Husky D. Their only option is the Husky C with the much lower income limit and those strict asset limits. So this has been a problem, and 2 states have taken the lead, not ours, New York and California. And California, over a year ago now, went up to 138% of poverty for their age, blind, disabled population. They were about 120, they were much higher relative. They were like 124%. They went up to 138. The other thing they did, effective a year from now, is they got rid of the asset limits entirely for SEC or their age blind disabled program. That is huge. It's the only state so far that's done that, as far as I know. The other state is New York, and New York is very much like us, besides the fact that they're our neighbor. They went from about 87% of poverty, sounds similar to 94, to 138% of poverty. And they went from 2,000 asset limit to I don't have the figure. I think it's like $23,000. So that's what our neighbor did. And now, so that's a trend, right? The two big blue states have decided to go that way. Is there a reason we can't do it? No. The history is that last year, Holly and myself and many others glommed onto a bill that was before the Human Services Committee. That bill said the MedConnect program, which is another Medicaid program. Remember I said there's three big ones and there's a bunch of little ones? There's a little one called MedConnect, which is very generous. And it's only for people who are totally disabled and working. By the way, there are such people. And right, meet the Social Security definition of disability, total disability, and they're working regularly. If you are under the MedConnect program, your income limit is $75,000 a year, which is about 5.5 times poverty, not 94% or 138, 5.5 times poverty. So it's very generous on the income, and on the assets, it's 10,000, 15,000 if you're married. 401k doesn't count. So it's more liberal on both of those things. Senator Lesser wanted to get rid of any income or asset limits for that program called MedConnect, which is kind of unprecedented in Medicaid land because Medicaid is a program we think of generally for lower income people, right? That's the whole point of Medicaid, unlike Medicare, which is that's just because you're older or disabled, regardless of your income level. That's sort of thinking about it anyway. And so it's quite a radical idea, I guess, to get rid of all income and asset limits for the MedConnect program, working disabled. We glommed onto his bill. And we had, at the hearing on that bill, we said, how about HUSKY C? These people have an income of like limit of like 1/5 or 1/7 or whatever it is, like just ridiculous, and $1,600 in savings. So we asked the bill be modified to go up to 138% of poverty for income and to raise the assets modestly to $5,000 for one, $7,500 for a couple. And lo and behold, the bill that came out of Human Services did both things. The original thing Senator Lesser wanted for MedConnect and what we proposed, a la New York and California, but more limited on the assets. And that was great, it was unanimous by Human Services. And then remember, Rose was talking about the fiscal note. Okay, so this is one where you're all sitting down, which is good because I'm going to tell you what the fiscal note is. So the fiscal note was truly, this is being recorded, truly absurd, as in made up. And before I tell you the figure, I'm going to tell you the entire cost of our entire Medicaid program in Connecticut is $6 billion. And about 2.6 of it billion is our money, state money, and the rest is the feds. So the feds cover most of it, but it's sort of 50-50. But the total budget of the entire Medicaid program is 6 and 2 point something billion for the state. The fiscal note of this bill was $1.1 billion. So basically, the Office of Fiscal Analysis said that almost half of what we spend now for the entire Medicaid program for about 1 million people, we're going to spend about 50% of that just to go for the only disabled folks to go from here to here and to do the MedConnect thing. So one of the things we've been collecting is evidence from other states, California and New York. And New York, believe it or not, remember I described it, sounds like they're doing the same thing we're proposing, except they're more generous with the asset limits. Their total projection is $20 million with an M, not a B. And New York is, by the way, about 5 times the size of Connecticut. So roughly 5 times as many people would be eligible, and $20 million versus $1.1 billion. California was like a little over 100 million for what they did, which involves getting rid of assets entirely, remember. So that's what we're doing, like Rose is doing, got a report from Rand. So what we're doing is comparing with other states. But the messaging I wanted to make clear is that it is a discrimination, and it's not like a venal kind of discrimination where people sat down and said, we don't like those people. It was that we had already set up the age-blind disabled program under Medicaid for decades. It's been running and running and running. And then comes Obamacare, this great thing, and they had to pick a number. I don't know how they picked their number, 138% of poverty, but they did. And by the way, someday we could go higher than 138% of poverty for Husky D and get matched. We just can't get the 90 cents in the dollar match, which is what all the states get now for 138. But, that is something to think about for the future, and I'd be totally in favor of that. But we're not getting that elaborate now. We're just going from 138. Anyway, they did that, and they just didn't deal with the discrimination against age-blind disabled. And these asset limits are very low, and they don't change with the cost of living, as went up 9%. So the $1,600 asset limit has literally been the same in Connecticut for decades, literally decades. So that's pretty much it. I did want to respond to the defense that might be used, which is, wait a minute, but these people already have health insurance. So why, they, and this was the thinking in Obamacare land as they were developing the massive statute. They were looking at groups that need help and groups that don't really need help, or how much help they need. And they looked at the folks who had Medicare, and they said, well, okay, they got Medicare. So let's focus on the other groups, right? That's fine if you don't realize that Medicare is not a comprehensive program. Those of you who are on Medicare know that. And there's all kinds of things that Medicare doesn't cover, which if you're a low-income person and can't pay out of pocket means you won't have it, you won't get it. And just the partial list is home care services, PCA. There are rare cases where you can get some limited Medicare funding of home care services, but by and large, you can't. So that's a real problem with the Medicare program, which I'm sure you're all, painfully aware of and would like to see fixed. Home care, a lot of durable medical equipment is not covered. Vision care is not covered. Hearing aids, dental care, that's a big one. Medical transportation. So there's a whole list of things that are simply unavailable under Medicare and only available under Medicaid, in recognition of the fact that low-income people don't have a way of paying for these things otherwise. That's why we cover it. And if we were able to increase the income limits and deal with the asset limits, we'd be able to address it. Last thing, the specific proposal is we'll go up to 138% of poverty. And at a meeting, the last meeting, I guess, we decide we're going to go up to 10,000, 15,000. Our proposal is the asset limit will be 10,000 for singles, 15,000 for couples. I'm done.
Cool. Thank you so much, Sheldon. And I just wrote a few little asterisks to make sure that when it's time for us to do our actual full state bill, instead of just a study bill, that I make sure that in our language is home care and transportation, because I know all of the other things that you've just mentioned is in our study, in our full state bill. I'm not sure about transportation or home care. I think so, but I'm not sure. Maggie, do you have a new question, or is your hand still up?
I do. Nope, I have a new question. Sheldon, what group is doing the advocacy on this? Is there a working group or?
Yeah, so as I said, Holly's on it. It's about, and it's growing, and you're all welcome if you want to be a part of it. I would. Molly Cole is coordinating it. Molly Cole, referenced earlier, is a director of the State Independent Living Center and also the coordinator for the Cross Disability Alliance. Basically, if there's people who want to participate, I would provide their contact information to Molly and say, could you add this person on, you know, whatever.
Okay.
But so it's a sort of the same.
Could you,
Sorry. Go ahead.
no, so could you add my name? That would be great.
I can ask Molly. Yeah.
Yeah, if you could ask her, that would be wonderful. I'm also, can you give me the number, and do we have legislation that's gonna be introduced by someone?
Right, yes. So basically, we are meeting, we had a meeting, but was postponed because of the death of Representative Williams. We have it now on Thursday morning with the co-chair of the Human Services Committee, Jillian Gilchrist.
Okay,
And we're going to talk about, obviously, the bill and what the bill says, and raising it to there.
Right.
Plus, we have to talk with her new co-chair, which is Senator Lesser. And you heard the story about what happened last year on the related bill. And I think what we're
Right.
talking about is to try to prevent this atrocious fiscal note, which, by the way, it didn't say which part was due to the one thing and which part was due to the other thing.
Right.
It just said blah, 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 blah,
Lump
blah,
sum.
$1.1 billion. So,
right,
so one of the things that we've already talked with Representative Gilchrist about is to separate the two bills if there's going to be two bills. So at least the fiscal notes, if they're going to do something crazy on the Med Connect saying, well, if we get rid of the all income and asset limits, the sky's the limit, you know, 2 million people will sign up. I don't know. So therefore, that's why we're putting such a huge figure on it. At least it will be there and not the Husky C thing. So it'll probably be separate bills.
Right.
what is 138% of poverty right now, as of January 1st?
It is, I'm looking at my little chart here. It's 1563 a month.
So
Whereas
how much is that a year?
15 times
17,000 something.
23,000. It's
17. No, it's not
17.
23,000. It's got to be 17.
15. Gotta calculate.
Yeah, I'm doing it now. Oh, crap. It didn't work.
Oh, it's like, yeah, it would be 18.
18,756.
Right.
Yeah, 'cause that's
Okay.
close to that. Yeah.
And for
All right.
contrast, Husky C is 1,062. So that's roughly 12,000.
Right,
Yeah.
Yeah.
right,
So
which is awful.
yeah.
Okay, thanks.
it's disgusting. Okay, so just quickly wanted to say that we are going to certainly try our best to also for Medicare for All Connecticut. I wear many hats in all of these meetings. Medicare for All Connecticut and my actual employer. But I do make sure that our voice is heard and that, you know, our group gets the information. And thank you for hanging a little bit longer. But I do want to make sure, and welcome to Rep. David Michelle is here. We want to try to get in our study bill this session as well. And it's just to do an economic study, just like Rose just talked about that they did through RAND. I'm not sure. I can't, I'm sorry. Hang on one second. Maybe Sheldon, can you read the comments? And I can't read right now. I'm sorry. Rana, Sheldon's my expert. Sorry about that. But we definitely need to get in our study bill, and we need to get some volunteer help to help us go over some language and to help us just basically run Medicare for All Connecticut. We are all volunteer run, and we definitely need help. Rana and I and Pete, when he is called upon, thankfully, do mostly everything. And we really do need help. So if you know anyone or if you would like to volunteer, please send us an email at info@medicareforallct.org. We're trying to engage people. So if you know anyone or you know how to, engage more people, please let us know. We really, really, really believe that healthcare is a human right, and we need more help to take care of this. Rana, do you have anything else that you would like to say?
No, I guess not. I think that at some point we will send out notices, updates of every legislator, so that even people who cannot get involved in like reading bills can talk to their own state reps and state senators and gauge how they feel about expanding healthcare, and either support them or push them, depending, so that we can at least get a study bill this year to get the ball rolling.
Thank you. Okay, anyone else have any final thoughts or questions or comments?
No,
I can
if there's
respond
any
to
way
the
I
chat.
can,
Sorry.
go ahead.
I just want to say I can respond to if you want, I can respond to Haley's question. So there's two ways that somebody who's over income can theoretically spend down over income for Husky C, that $1,062 a month, and qualify. One way is hit or miss, and that's if you happen to have significant medical bills, like you go to the ER, you don't have insurance, you have a medical bill, you can submit the bills to DSS, and if the bills total the amount of the difference between your actual income and at very low 1062, 1063, then you can qualify for Medicaid. It's like a big deductible, and it qualifies you for Medicaid for up to 6 months. And then you have to incur bills all over again. So that is a theoretical possibility. A few of our clients can do it. It's very difficult because most people try to avoid incurring massive medical bills. And if you do, I mean, and emergency room is one of the few places you can do it. Most providers just won't take you. They're not assured of payment. Only hospitals actually have to take you by law because of the anti-dumping statute. So it's a very challenging thing, but there are some people who can sometimes satisfy that. But the question in the chat was really about another kind of spending down, which is sort of more of a permanent thing, and you create a pool trust. And what you do is you set it up. It costs, $2,000 or $3,000 to set it up, which is a problem, but you set it up, and then the excess income over that 1062, you don't get anymore. And it goes into this trust, and it's a little complicated, but basically there's instead of your own, it's like rich people trust with an individual trustee. It's like done as a group thing, and it's a nonprofit that manages it, and you set up your plan, and the excess income goes into the trust for your benefit, but it can now only be spent for certain purposes, and the trustee has to decide and all that. So what you give up, besides the cost of actually doing the thing, setting the thing up, the fees of it's a little complicated. It's like $1,000, I think, for the fee for plan, but then you may need a lawyer, and then that's where it adds up. So that's that cost, but it's also that you've given up now this excess income. Not excess income. It's not a lot of money. It's the same amount of money that qualifies for somebody for Medicaid without any spending down under Husky D. But with that excess income, you don't have it anymore, to spend as needed. So there's a cost to that. And when you die, also it goes to the state, but that's a pretty small thing.
Oh,
So
wow.
but the answer to the question is correct. I mean, it's a good question that Haley asked, and that is a theoretical thing, and we have to be prepared to address that because for some people that is a possibility.
Wow, okay, you taught me something new tonight. Thank you both. I had no idea that was even a thing. Okay. Maggie, did you need to say something else as well? I'm sorry.
No, I just had a question. Is there a bill that you're trying to get someone to introduce the study bill
Uh,
in this session before the
Well,
deadline, or?
Dave, obviously Rep Dave and Michelle has always been our champion. We're trying to get other co-sponsors or as well. So if you know that your rep, or, you know, if your rep would be another amazing champion for us as well, that would be fantastic. Oh, hear his name.
Hi, Holly.
Hello.
I have good news.
You do?
Yeah.
Oh,
Tomorrow I'll put in the bill, and we've got, well, right now I've got 3 co-introducers, but I think I'll have 5 at the time tomorrow. Yeah.
you're amazing. Thank you.
Of course, Ann Hughes,
Great.
Ann Hughes immediately offered to co-introduce, and Andre Baumgartner responded faster than Travis and Robin. But I'm supposed to, Robin and I are playing phone tag all evening. It's very, very like multitasking time.
You
So-
tell Robin I will go to her home. I love her. I love her to death. She knows it. So,
So-
well, that's amazing.
And what I'm explaining, what I'll explain to the LCO is that we need to merge. That's not for immediate, but for later for the language. That
Yep.
we need to merge what we had as text with SB 1090 minus the commission, basically. Senate Bill 1090 from 2021. And I've told, and I'll be very clear: no commission.
Yes, please,
Yeah.
because that does not work well for me.
Well, that
Okay,
was purposely done to sync the bill because it came with a fiscal note, and then the chair and Human Services
I
didn't
know.
want to kill it right in Human Services and went as chair of the subcommittee in appropriations to kill it there because
Yeah.
it was over $200,000 or $500,000.
I know, it was ridiculous. Okay, well,
Oh, good.
on this note
What
now,
committee,
I'm going to end.
what
the-
committee will it be in?
Oh, but
What
that's
committee will it be?
it's always in Human Services.
In Human Services, okay.